Many people think CBT and REBT are basically the same therapy. And honestly, I get why. In both approaches, clients learn to think differently, and they often feel better as a result. But here's the part that gets missed. Sometimes the same cognitive shift is happening, but it's happening for very different reasons. Imagine a client who says, "If I make a mistake at work, it will be terrible, and I won't be able to handle it." This is a familiar presentation: anxiety, pressure, fear of evaluation. Now watch what happens when we work with this belief in two different cognitive behavioral traditions. In CBT, the therapist might slow things down and ask, "What's the likelihood that making a mistake will actually lead to serious consequences?" The client begins to examine the evidence. "I've made mistakes before, and it didn't end my career. My supervisor didn't react the way I feared." Gradually, the belief softens. Maybe this outcome isn't as likely as I thought. The emotional shift comes from re-estimating probability. Less danger means less anxiety. The world feels safer because the threat feels smaller. Now notice what changes in REBT. The therapist doesn't focus first on how likely the mistake is. Instead, the question becomes, let's assume the worst happens. You make the mistake. People notice. Then what? The client might say, "That would be awful." And the therapist gently presses awful or deeply uncomfortable. Would it truly be unbearable or just very unpleasant? Over time, the belief shifts to something like, "I really don't want to fail, but I could stand it if I did." The anxiety drops, not because the world is safer, but because the client no longer sees discomfort as catastrophic. On the surface, both clients sound calmer. Both are thinking more flexibly. But notice the difference. In CBT, relief often comes from lowering the perceived risk. In REBT, relief comes from lowering the perceived devastation. CBT asks, "How likely is this?" REBT asks, "Even if it happens, do I have to destroy myself about it?" And this is where I want to be very clear. This isn't about one model being right and the other being wrong. CBT and REBT share a common spirit, a commitment to helping people suffer less, function better, and live more meaningful lives. They simply offer different paths to that goal. Some clients feel steadier when the world seems less dangerous. Others feel steadier when they know they can handle life, even when it goes badly. When we understand these differences without vilifying either approach, we become more flexible clinicians, and our clients benefit. This distinction matters clinically. If we confuse the models, we risk mismatching clients and methods. But when we understand both clearly, we can choose thoughtfully, not based on allegiance, but based on what actually helps the person in front of us. In this video, we just touched the surface. In the upcoming live stream, we'll go much deeper into how CBT and REBT conceptualize beliefs, emotional disturbance, philosophical assumptions, and how clinicians can integrate both approaches without blurring the models. If you're a clinician, student, or thoughtful consumer of therapy, you won't want to miss it. Before you go, if this kind of clinical clarity is useful to you, please like this video and subscribe to the channel. That way, you'll get updates about this upcoming live stream and future trainings on CBT, REBT, and evidence-based psychotherapy without oversimplifying the models. Thanks for being here.